Just checking in on the surgery that I'm having tomorrow. I'm going to be starting a bit of a video blog for the progress along the way. I'll be having a TLIF Spine Fusion surgery at L4-5. And this is started 4 or 5 years ago that I've been in pain. Haven't really been able to do a whole lot of standing or walking. It's difficult and painful for me to walk the dog. It's difficult and painful for me to go to the grocery store, especially one with a concrete floor or someplace like Costco or things like that where you're on your feet is just excruciating. I can hardly get into the car afterwards. So that's where I'm at. I have tried pretty much everything. They originally thought my pain might be coming from SI pain or facet joint pain. I've had MRIs done and they did find some arthritis in both the facet joint and in the SI joint. We've tried steroid injections into both of those joints at different points of time, which weren't very helpful. And also we tried even a rhizotomy, which is like where you kill the nerves around that facet joint, which also wasn't helpful at all. So the next step was to test my discs, which we did by a discogram or discography test, which was a pretty intense, crazy test, but the good news is that it's very conclusive. So you're not going to go through this test and not know if it's your disc or not your disc. It's going to be black and white, yes or no. So what they do is they give you a kind of a mild sedative, but you do need to be awake and aware of your pain levels so that you can communicate that to the doctor. And they lay you down on your face down and they inject fluid into some discs in your back. And the rule is that a healthy disc should be able to take on a fair amount of fluid without pain, but an unhealthy disc is going to cause you a lot of pain. So they injected first into my L3, L4, and I did have some pain, a pretty good amount of pain, but it was dissimilar to the pain that I normally had. It was more in the middle of my back, a lot higher than usual. So there may be a chance that going forward, that disc may begin to degenerate, and I may need to have fusion up there at some point. But right now, they felt like that wasn't necessary. Then they injected L4, L5, and it was an amazing, huge amount of pain. I rated it a level 9 out of 10. So it was really probably the most pain that I have probably ever been in. And it was right at the right spot where I have my typical back pain. So that was really conclusive. And then lastly, they injected L5S1, which is a very lower part of my back. And there really wasn't any pain at all, like a level 2, a little bit of discomfort, but not really pain. And then they did some images after that of those discs just to get all of that information captured. But it was very conclusive. And the doctor recommended after that test that I do have fusion for L4, L5. So that's what we're doing. We're doing it tomorrow. And I have had kind of a hard time through the internet trying to find a lot of people's experiences with this type of fusion. There's a lot of people who had the kind of the older, more traditional back surgeries for discs. And those are what I have heard a lot more intense, more difficult to recover from. So this is a minimally invasive surgery. They give you a ton of information, which is great because I like to know what's going on in my body. I'm a bit of a control freak that way, but it works for me. So it is what it is. So I'm still not 100% sure, and I have plenty of time to talk to the doctor before he starts the surgery tomorrow, whether he's going to do a lateral fusion or what they call a transforaminal lumbar interbody fusion. So one is an L-LIF, it's lateral. The other one is a T-LIF. My paperwork all has T-LIF. So it's really just the difference of location. So if this is your back, it's whether they're doing the incisions on the side of your spine and going in that way, or whether they're doing it on the side of your back and going in laterally. Either one is an option for me. It looks like I'm having the T-LIF, but like I said, want to double check that with him so that I know for sure. So they give you a ton of information. You'll go into a pre-surgery appointment, which is several hours. They do a ton of different blood testing and nutrition testing. and give you a whole bunch of information. I got a whole packet from them with information about what the surgery is going to be like, what the fusion is, what your recovery expectations should be for the first couple of days after surgery, and what your mobility restrictions will be. So really helpful. They also do, at this hospital at Skyridge, they also do classes every Monday. If you want to go into a class, and they'll teach you just more about what to expect. You could ask questions. So I definitely felt like I had the opportunity with the surgery to go in with my eyes wide open, having all the data that I needed. Also in that preoperative appointment, I met with another doctor, another physician who went through, I just brought in all the supplements. I don't really take anything for pain except for ibuprofen, quite a bit of ibuprofen, but that's all I typically have taken. So I brought in all the supplements that I take, just a couple different, like I take a multivitamin with some like greens and stuff in it. I take omega-3, I take vitamin D, B12, just a couple different things. I just brought everything. It was easier than trying to write everything down. And the doctor just took a look at all the bottles and said, yes, you can take this. No, stop taking this. Because I was a week before the surgery. So they try to get you a week to 2 weeks prior to surgery. They want to just make sure that you're not going to be taking anything that's going to interfere with the surgery or your recovery. So he did have me come off a couple of different things, and increase my vitamin D. So vitamin D is really helpful in establishing bone growth. So he had me go from 1,000 units of vitamin D to 5,000, and I just use the vitamin D that the doctor sells out of his office. He's got a couple different things that he does. He does a vitamin D supplement that's just a liquid. You can put it on your tongue, and it's really highly assimilative. I don't know if that's the word. And then also he does this protein drink, but just under 20 grams of protein a serving, and he recommends that you start this as early as possible. I started it a couple of weeks ago, so I've been taking it, I would say, for almost a month. I've been taking at least one protein shake every day of this particular protein. I typically do a smoothie in the morning with greens in it. Sometimes I'll put a scoop of protein in there. But having used a bunch of different protein powders, I really like how this tastes. It's just as good as anything else that I've used. It's not wheat-based. I don't do gluten, and it doesn't have any gluten in it, so works for me. Tastes good. Doctor likes it. Especially formulated for bone growth. Seems like a no-brainer. So I definitely do that. And part of my surgery instructions are, which is a little bit unique, usually you go in fasting, and you are sort of fasting, but 6 hours before your procedure, you do a protein shake in a high carbohydrate juice, so like in a grape juice or something with like 4 grams of carbohydrates in it. And then right before the surgery, like 2 hours, I think, before the surgery, or an hour, the nurse mixes you up another serving of those. So you're going into surgery with some protein in your body, and I imagine that that's really going to help with like nausea coming off of your pain medication in the surgery, and just kind of like beefing up your body to start to heal right away, which I just think is really, really great. I've been really impressed with Dr. Prusmack, who's my surgeon, with his really holistic approach to all of this. He just seems like he's thought of everything, and he's constantly evolving, so that when he learns that something helps, then we integrate that and we move forward. So it's pretty exciting and great to have that level of confidence in the surgeon for such a major surgery. I've never had anything like this before. So that was my pre-op. They also gave me, just to keep the infections to a minimum, this hospital has like crazy low infection rates. It's like 0.4%, where I think across the country it's like 6% or something. So it's just ridiculously low. And I think it's because of their preoperative precautions. So they've got me using this ointment that you just put on a Q-tip and kind of put it inside each of your nostrils and like massage it in there twice a day for 5 days before surgery. Also, they gave me these kind of look like thick baby wipes, and they have some type of a antibiotic solution on it. And after the shower every morning, I just rub that around my abdomen surgery site for about a minute or two, and then just kind of all over my body so that I'm like totally disinfected each day. And then they'll do those antibacterial on the day of the surgery. They'll do that skincare to prep me for my surgery. So really well prepared. Between the hospital precautions and the surgeon's precautions, I just feel like I am in such good hands. They also are concerned about preventing constipation after surgery. When you're taking narcotics, it dehydrates you, but also it just is slowing everything down. That's why you're not in pain. But when it's slowing everything down, it's also slowing down your digestive tract. So constipation is really common and can be really, really uncomfortable. I've heard from a couple other people that was their most uncomfortable part of the early recovery, was just that they were having a really hard time with that. So they recommend that you just stay really hydrated. And I'm trying to integrate as much fiber into my diet this week as possible. Like in my smoothie today, I put some chia seeds in there, just like a tablespoon, but they're really high in fiber and really great. And then I'm trying to have just like really full fiber meals, big salads. I made a big like pot of chili with like black beans and sweet potatoes and stuff, just to, the black beans are high in fiber. So just trying to do everything I can up front to help with constipation afterwards. I know it's not a fun conversation, but it is what it is, right? So a couple of the things that I purchased in preparation for my surgery, and they're supposed to come today or tomorrow, by Thursday at the latest. I should be home by Thursday or Friday, so I really hope they come in time. I did get a shower chair. Showering is very important to me, and I would like to be able to shower as quickly as possible and as often as I need to. And if I'm standing and having risk of slipping and having to concentrate on like standing there, I'm not. It's just a thing. So I did get a shower chair so that I don't slip and fall in the shower. I did get one of those raised toilet seats. I think it adds like 5 inches or something onto your toilet, and then it has like handles on it. So it just kind of helps you use your muscles, like your arm strength, to get on and off, because that's just another thing, is like in and out of chairs, on and off the toilet, in and out of bed are just things that like for the next 12 weeks are just going to be tricky. I can't bend or lift more than 5 pounds or twist. So mobility is going to be tricky. So I'm trying to just do everything I can to make it as seamless as possible. So I did get that for the toilet. I got one of those little reacher things. So it's like, my kids had them when they were little. It's like a little claw on a long arm, and you kind of like have a spring-loaded handle, and you can reach stuff so that if you drop stuff, you can pick it up without having to bend over. So I did get one of those. They were really cheap. All this stuff was cheaper than I thought. I think the chair was like $30. The toilet seat was like 30 or 40. The reacher was like probably $10. And then I got this sock thing. It's March. It's not May. It's March. And in Colorado in March, we really get like across the board, like it's like 70 degrees today, and then it snowed yesterday. So I want to be able to wear socks and shoes if I need to. Hopefully I won't need to that often, and I can, put slip-on shoes on. But I did get one of these cool things that you like kind of just like put your sock over these little, it's like a shoehorn. It's like 2 shoehorns on the side, and you slip your sock over it, and then it has like handles so that you can like pull your sock on without bending over to reach your feet. So all these things so that I can be as independent as possible after this. So I think I'm pretty prepared. I'm optimistic. I have my pain goals. I have my recovery goals. I tend to be a little bit overambitious with things. So that's going to be my challenge, is slowing down and being gracious and just letting this be a journey. But I do have some goals. I think that's a good thing. I want to be off my pain pills, 100% off of them by the end of week 2. I think that's ambitious, but I think it's pretty reasonable, especially if I've got other things. Oh, I got a at-home muscle stim machine. They had a guy, the surgeon recommends these, and he had a guy bring it out. This went through my insurance too, so it's not like it cost me a bunch of money or anything, but it's a little muscle stim. It's like a little home use muscle stim machine, and has like the little pads, and you put it around your surgery site, or the spine area, and the muscle stim is really supposed to significantly help with pain control and really help people who want to get off their pain pills quickly, which I do. And my surgeon wants me to get off of them too. He's really that type that wants you off your pain pills and up and healing. If you're the type of person who wants to stay in bed and keep popping pills for the next 6 months and expect to have a decent recovery, I just don't think that is the right way to do it. So I want to get off the pain pills. I want to get up and moving. Of course, there's a great chance that 2 weeks is going to go by and I'm going to be in excruciating pain, laying in bed, crying all the time. So I need to be open to that possibility and gentle with myself. So everything, it's tomorrow. I'll check in at 7:30. My surgery starts at 9:30. It should be done by between 2 and 3 hours. And then I'll go a couple hours in recovery and then check into my room for 1 night, maybe 2 nights, and then come home. And we start the healing and we start the PT after a couple of weeks. I've already gone and done a baseline PT test. It took 2 hours. They had me doing wall sits and side planks and all the stuff just to kind of figure out what my base level of fitness was, so that I know what I'm shooting for at the end of the 12 weeks. And I'll start PT, I think, after 2 weeks. So I will check in from time to time and I'll let you know how the recovery is going and how my process is going and how far off my very ambitious goals I am. But I hope that things will go well, and I think they will.